Good evening. My name is Thomas Harvey. I'm in the Postmaster Certificate for Psychiatric Nurse Practitioner. And I live in Northwest Arkansas, and currently we're under a tornado watch. So there's been a lot of thunder and lightning in the background, and I'm just trying to record this, hoping that I don't lose power and am able to upload a video. So looking at the case study of LL, she's a 47-year-old African-American. She's obese. She has high cholesterol. Other things that I noticed is her A1C is 8.5%, and her fasting blood glucose is 235. So my initial thought was, okay, well, maybe her fasting blood glucose was incorrect. But when you look at the A1C, it's not incorrect. Kind of falls in line there. She's obese, BMI of 33. So different things that I thought of right off the bat is, she should set goals for some weight loss, exercise, diet, have a diabetes nurse educator, and really try to lower that A1C. Different notes that I have here. So I was looking at an article from the Nursing Research and Practice, and specifically they were working on interviewing mothers that had gestational diabetes, and they were working at interviewing mothers from Sweden. It said that globally, 14% of all pregnant women develop GDM, and then in Sweden, it's 5.2%, so they're living much healthier, but they still have the risk of gestational diabetes there. And they really tried to interview people face-to-face. They were not able to during COVID. So they said during the interview, they recognized that there were some challenges. So they specifically, women are, the women they were counseling with were obese. They needed special diets. Some of them had eating disorders or came from certain cultures. So those were some challenges that arose. Okay. Just a few more things that I highlighted and I read through here. Okay. Oh yeah, so one of them I said, so the interviews were not face-to-face, because of COVID. They had to do the interview by phone, and it's really difficult with that because you couldn't see the expressing of body language. So another article that I read helped inform me. So it says 14% of worldwide nursing is responsible for monitoring during pregnancy. And this article specifically is from the Environmental Research and Public Health Journal. It's an international journal, and it said there's a positive relationship between physical activity and the control of gestational diabetes. It said resistance, aerobic exercise were really effective in the control of gestational. It can help control the glucose, lower A1C, and also decrease the amount of insulin that somebody's receiving. They encouraged that somebody would exercise 20 to 50 minutes, a minimum of 2 times a week of moderate intensity. So specifically, their question, their PICO question was, for the population, they were looking at mothers with gestational diabetes who were pregnant. The intervention, they were trying to create a cardiovascular resistance training and resistance exercise. So the outcomes, they were hoping that women would have a more healthier pregnancy. So in this, they chose 17 different articles to review for a systematic evaluation. So, and they concluded that aerobic resistance exercise, or a combination of both, are effective in controlling glucose, A1C, and insulin. And they really felt that this study was important because there's there's not enough studies that talk about what is sufficient amount of intensity for somebody that has gestational diabetes. So my last source that I was looking at is from ACOG, the American College of Obstetrics and Gynecologists. And these were just frequently asked questions. And I was looking, talking about the different levels of obesity. So obesity category 1 is a BMI 30 to 34.9. So we know that our client is 33. And then there's just different things that can happen, informing our patient, like, okay, you could have high blood pressure, preeclampsia could be one of the risks, stroke, gestational diabetes. It increases your chances of a cesarean birth and having obstructive sleep apnea. So you really want to make sure that they are able to exercise, eat healthy foods, and that they consult with their gynecologist. Anyway, thank you. Again, my name is Thomas Harvey, reporting from Northwest Arkansas. Thanks. Bye.